cardiac arrest.
I'll get it. Right away. Wait. Charge pounds 200.
No, that's not the right way. Wait. So usually for the code blue, that means patient's heart stopped beating, okay? So if the EKG is like a flat line, defibrillation is not going to help. What you need to do the first is the chest compression. Chest compression. Pages.
Answer every page at a run.
Right, we got a lot of pages during the residency. Exactly the same shape of pages. We need to check all the time. B, 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 B.
Bottom of the surgical food chain. Run labs, write orders, work every second night until you drop, and don't complain. On call room.
So it mentioned the residency need to do a 48 hours shift. That's very inaccurate. Why? Because in 1984, there is a teenager, 18 years old, named Libizon, who died because of the resident's medical prescribing error. Why this residency will make mistake? Because this residency is doing 36 hours shift. Just imagine you don't have any sleep for 36 hours. So in 1987 in New York hospitals, nobody can do more than 80 hours shift per week. And usually they don't recommend you do more than 24 hours continuous shift. So 48 is too much.
Are you sure that's the right diagnosis?
Well, I don't know. I'm only an intern. Here's an idea. Why don't you go spend 4 years in med school and then let me know if it's the right diagnosis?
Whoa, that's the intern talk to the nurse. That is not the way the intern usually talk to the nurse. Usually the intern is very polite to the nurses because the nurses will also give you the evaluation later, and if the nurse wants to give you some trouble, you are always in trouble.
Okay. Dr. O'Malley, our patient's pulse ox is dropping. She's agonal. She needs to be intubated.
This is inaccurate. When patient's blood pressure is dropping, usually we call at least RRT, Rapid Response Team, to come, not just randomly grab a doctor on the corridor.
Pulse ox down, 87%. Bag up, 2.
Oh, Dr. O'Malley is doing intubation for the patient. But something's wrong. If you look carefully about this tube, something's wrong. Did you get it? This tube is very soft. You can't go through the vocal cord without the help of the guide wire. Let me show you the guide wire. Da-da-da-da! This is the ET tube and this is the guide wire. This guide wire will support the ET tube successfully go through the vocal cord. Again, this ET tube does not have any guide wire inside. It will be very... Oh, the patient lost the pulse. Chest compression! Chest compression! Lower the bed! Lower the bed!
Oh, come on. Come on.
So, Dr. Shepard is doing the chest compression, which is correct, but in this situation, we need to lower the bed to get a good chest compression. What is high quality chest compression? That means you need compress 100 to 120 times per minute, and the depth should be about 2 inches. If the patient's bed is that high, you can't achieve 2 inches chest compression.
Time of death is 11:42.
Does anybody here speak Chinese?
This is not accurate. In all the hospitals, we have interpreter lines. So any kind of language, you can find the interpreter line and you can talk to patient. Sometimes it's audio just from the phone, and sometimes it has video using the iPad.
Mr. Jones has chunky veins and he really needs antibiotics. I should start a central line.
Whoa, using the central line for the antibiotics? Are you kidding? This is too much, you know. The antibiotic, usually we can use some ultrasound guided peripheral IV line, or you can use the middle line, which can be done on bedside as well. But central line, that's usually for some unstable patient, like the blood pressure is dropping, or some unconsciousness patient, like the coding patient. We will do some central line on the groin area, or sometimes in the neck area. Rectal exam.
Okay, so I'm just gonna insert my fingers.
See, it said fingers. That's inaccurate. Nobody do the rectal exam with fingers. The rectal exam always with one finger. Most of the time it's index finger. So another thing I need to say is look at the window behind. You know, that is very, very inaccurate, and because you know the HIPAA, the butt like exposed to the outside. Just imagine like how hilarious it is if someone just walk by and see this situation. Grey's Anatomy, let's go!